Good evening, welcome to Primetime News. I'm Anupama Suvarna. Right now, the headlines. Stop corruption and malpractices, Lokayukta interacts with doctors. Uttarakhand Pari, the ferry girl cries where her parents are. Heavy rains lashes undivided Dakshina Kannada, plantations ruined, homes damaged. Parents beat and electrocute son, psychopath student lost his life. Bajpayee air crash May 22, 2010, High Court stays proceedings. Kalangut prostitute den, 18 women rescued in Goa. Not to felicitations and PETA, statement made by Chief Minister. Destroying the evidence on sexual assault, two brothers of accused arrested at Manipal. Alleged complaints of rampant corruption in the delivery of services at government health facilities, Karnataka Lokayukta Y. Bhaskar Rao has asked doctors and health personnel to shun corruption and malpractices while providing treatment to patients. He was interacting with doctors, paramedical staff and technicians of the Health Department district and taluk level hospitals in Bangalore. The Health and Family Welfare Department had organized the interactive program with the Lokayukta and two Upa Lokayuktas at the Vikas Sauda for the first time to exchange views on numerous issues in delivery of healthcare. Upa Lokayuktas Justice B. Majjage and Justice Subhash B. Adi were also present. Rao said service delivery at the government hospitals was far from satisfactory on account of involvement of medical and non-medical personnel in irregularities and corruption. Doctors should treat the profession for service-oriented and turn away from receiving bribes and gifts from patients who visit hospital for treatment. The centre and state governments have been allocating adequate funds to ensure quality health service to all people visiting hospitals for receiving treatment. Instead of treating patients, doctors recommend private hospitals for better service, he said, pointing out that it was a great disservice for the people. Minister of Health and Family Welfare U.T. Khadar told doctors and staff of the department to change their mindset and attitudes while providing services to the poor and the public. Wearing a white frock with violet flowers and her two tiny legs in plaster, a 2.5-year-old girl who got separated in the deluge from her parents in Kedarnath and was rescued is not happy, just clutching her big bright doll. She demands attention and wants those taking care of her to take her out from the drab, white and walled hospital room to the bright sunshine outside in a pink pushcart. But that too soon bores her and she cries and asks for Mama and Papa. There is no answer from those around her, mostly NGOs, women workers of Bal Vikas and Anganwadi, and the many who come to see the wonder kid from far and wide. No one knows how to fulfill the one wish the girl is asking for. Every day dozens of people come to see the girl who escaped the fury of nature but got separated from her family in June 14-17 incessant rains and cloudbursts that triggered landslides leading to hundreds of deaths and an equal number of people going missing in Uttarakhand's Mandakini and Alaknanda valleys. The girl was reportedly picked up by a driver crying and in a pitiable state from Kedarnath area and was handed over to the state authorities. She was first admitted to a hospital in Rishikesh with broken legs and was then shifted to the Dehradun-based Doon Hospital on June 24th. As the girl cannot speak anything apart from Mama and Papa, no one knows her real name. Finally, she has been given the name of Pari or Ferry. The hospital register shows her parents as unknown. Pari has adjusted to her new environment, said nurse Geetha Rawat. The initial days were very difficult for her and also for us. She continuously cried for her parents. We didn't know how to make her stop. Both her legs are on plaster and it will take at least a few months to heal. She has now adjusted to this hospital, her room and the people around her. She has started eating now, but yes, she still pines for her parents, Rawat told. From her clothes to her food and toys, many people have come forward to extend a helping hand. Moved by her plight, State Chief Minister Vijay Bahuguna also met the girl and has ordered special medical treatment for her. At all times, there is now an Anganwadi worker who stays with her, and at no time is she left alone. Usha Negi of Akhila Bharatiya Mahila Panchayat is one of the NGO workers who has been coming and spending time with the girl. The girl has won many hearts. There has been monetary help too, but we don't accept it. So people buy to her whatever makes her happy. Heavy rains have been lashing various parts of Dakshina Kannada and Udupi district since the past 2 days. It rained throughout the day in Mangalore on July 2nd, and the city is also witnessing incessant downpours even on July 3rd. Puttur too has been receiving heavy rains. Strong winds damaged some plantations and houses in Ichlampadi area. Heavy rains have also been reported from Modubidri, Sulya, Suratkal Kinnigoli and Mulki areas. The pilgrim town of Subramanya too is experiencing heavy downpours with Kumaradhara and other small rivers overflowing. The water level in Netravati river has risen to some extent. In Ullal, the house of one Syed Muhammad of Ambla Mogaru was damaged. Even the houses of Mariamma and Usman were damaged. In Konaje too, one house was damaged in the rains. Various places in Kundapur too are receiving rains, disrupting normal life. Now take a short commercial break. Parents beat and electrocute son. Psychopath student lost his life. Bajpayee air crash May 22, 2010. High Court stays proceedings. Kalangut prostitute den, 18 women rescued in Goa. Not to felicitations and Peta, statement made by Chief Minister. Destroying the evidence on sexual assault, two brothers of accused arrested at Manipal.